Hi, I'm Alex Howard, and I'm here with Tanya Page, Director of Nutrition at the Optimum Health Clinic. Hi Tanya.
Hi.
And in this video we wanted to do a short introduction to nutrition at the Optimum Health Clinic. Now obviously this is a huge area, there's a lot that we could say about this, and there's quite a lot more content on the website, so you can see further videos, and really in some ways this is kind of a summary of a lot of the other content that we've got here on the website. Now, Tanya, as a kind of starting point, this is obviously a really big question that we could say a lot about, but what do we mean by nutrition? Because I think quite a lot of people have a preconception that it's just about diet and food, and obviously that's a part of what we do, but there's also a lot more that we work with people.
Absolutely. I think what people are eating and how they're eating it is important, and for some people that can be really key. But for quite a lot of people who come to the clinic, they've actually done a load of hard work on their diet already, and actually it's pretty good. So if that's all we did, that would be a bit of a shame. So, and any nutritionist would answer this question the same, but particularly for the group of patients we deal with, it's a lot more complex than that. What we're actually after is the answer to the question, why is this person experiencing these symptoms? And what has caused that? And what is imbalanced in that person, and what can we do about it? So where psychology can really help in terms of getting that person into a healing state, the body can only do so much. If someone's been ill for a long time, the body systems can be quite imbalanced. There can be a lot of deficiencies as a result of what's been going on. So to get that back, often we have to give the body raw materials, and actually really find out very clearly what's going on so that we can put it back to balance.
Yeah, and there's just a couple of things maybe to say about that. How do we find out what's going on, and how do we bring it back into balance?
Okay, in terms of finding out what's going on, we learn a lot from the questionnaire that people fill in. By talking to the patient, we can really get to grips with more precisely what's going on. We get an awful lot of information from the patient. We ask patients to do simple tests at home that gives us quite a lot of information about their sort of metabolic status, what's really going on at a cellular level, through very, very simple home tests. And these are either free or very, very low cost to do. Where appropriate for the patient, we might ask the patient to do functional tests at laboratories. So where they may have to send off samples of blood or saliva or urine or whatever, to get more specific information. But obviously we would find out particularly what areas need focus before testing those areas.
Yeah, because obviously there are many tests that we could do, and it's patient specific, it's also budget specific as well, because
Absolutely.
obviously from our point of view, the more information we have, the better, but we're also very experienced of working with people at their own reality of their situation.
Yeah, and also there's a right time and a right place to do certain things, because I often say to patients, they might start with 10 quite severe symptoms, and by addressing one area of the body, such as adrenals or gut or whatever, we could actually reduce those symptoms down, and therefore we wouldn't need to do X, Y and Z tests.
Yeah.
So it's a matter of doing it in the right order, in a logical manner that's going to be of most benefit to the patient, but also at a price that's doable and at a pace that's doable for the patient as well, because you can't address everything at once.
Yeah, no, of course. And then once we've got that information, how do we work with it? So if it comes back, for example, that we do a test for someone, it's clear there's something which is suboptimal, and we want to work with that, how do we address that?
Well, it depends what it is. Quite often it's just a matter of, if we know what's wrong, and we know what's deficient, or if we know what's sometimes happens in excess, that someone's got too much of something, we can help to balance that with nutrients. So it would be therapeutic levels of supplements normally to give the raw materials for a process to happen, or if the balance is wrong, to kick the balance back the other way by giving something complementary for that.
Okay.
It may be lifestyle factors as well that need to come into it. There may be a lot the patient practically can do to help their situation.
And it may also be obviously in conjunction with the psychology team and what's happening there as well.
Absolutely.
So that being kind of what we do, I guess there's also a question of what's unique about the Optimum Health Clinic approach, because obviously there are many nutritionists which are out there which may believe they can help people with a range of different conditions, including something like things that we work with. But obviously we have a very specific experience and a huge amount of knowledge working the way that we do.
Yeah, I suppose that the key thing is that we do this day in, day out. This is what we do. So whereas a standard nutritionist would see someone with chronic fatigue, fibromyalgia, maybe once, twice, 3 times a year, we're seeing sort of in some cases 12 times a week, which is a very different
just for
scenario.
One practitioner.
Yeah. So because you're just consistently seeing these types of patients, you're picking up on patterns, on trends, on the likelihood of what's going to happen when you do certain types of protocols. So therefore your knowledge base is so much bigger.
Yeah.
And, you know, in order to work with these patients, we have to have really, really good practitioners. So essentially what we've ended up with is a team of really good practitioners, some of the best in the country. Now, we're lucky to have them all in one place. So, you know, when we're working with patients, particularly quite complex patients, we've actually got that facility to go and talk to 6 other very good nutritionists who are experienced in ME, chronic fatigue, fibromyalgia, and that really doesn't exist anywhere else. So, you know, all of us in the team really enjoy being a part of that because it's so inspiring being amongst others in the team who are that good.
Yeah.
And so, you know, essentially the patient has access to, you know, a team of 6 or 7 practitioners in reality, even though they're dealing with one of them.
Yeah, which of course also have the backing of the psychology team, the research team, and the medical department as well. It's that real kind of combined approach.
That's right.
So, you know, I guess the next question becomes is what can people expect as part of being a patient and nutrition department? Because, you know, often the question what people will ask is, you know, can you cure me? You know, if I come to, you know, to nutrition at Optimum Health Clinic, you know, how long till I'm fully recovered? How do you answer that question for people?
It's a very difficult question to answer. As nutritionists, there are certain things that we're not allowed to say about recovery and curing and things like this. But from our experience, what we can say is that if we know, if we investigate the case well enough, we can see why the person is in that situation. And if once you know why, you can easily see your way out of that. I'm not saying that journey will be a quick one necessarily, but at least if you know where you're going, you know what you have to do, it's a better situation to be in. I think in terms of how long it might take, that's really, really variable. Someone who hasn't been ill very long, for instance, you know, only a few months, then the recovery may be in a matter of months. But when you're talking longer than that, you know, been ill for 30 or 40 years, then you know, you can see that the journey might be a little bit longer.
Yeah. And I think that's one of the reasons why things like 15-minute chats are so valuable, because someone can give a bit of a brief description of their situation.
Yeah.
And when a practitioner has seen literally hundreds of people as part of a department that's seen thousands of people, it kind of becomes much easier to put that in almost a roadmap of, okay, so you've done these things, you've got to here, you've had this history, these symptoms, it's highly likely something similar has been seen before.
Yeah.
And that's where that knowledge base is so important, because it becomes easy to say, well, my best guess based upon this information is I would expect to see A, B, C, X, Y, Z over this rough timescale. That's not a guarantee, but that's a kind of an educated guesstimate based upon a huge amount of experience.
Yeah, and also I think it's worth saying that you know, we can't say we don't have 100% success rate. It would be silly to say that. However, you know, the vast majority of people, we can help and we can improve symptoms, if not take them to full recovery. So I think the thing to say is we never give up on a patient unless they give up on us. And we also won't sort of just keep on treating for the hell of it if it's not actually beneficial for the patient.
Yeah.
And we kind of, from experience, know when that is. If we've come to the limit of what we can do, but we can see that someone else in another, another practitioner or another type of practitioner may be more helpful for that person, then obviously we would push to refer onwards. So we kind of don't leave people in the lurch.
Yeah.
You know, we would see them as far through their treatment
Yeah.
as we possibly can, if that makes sense.
Absolutely, and I think it's also, this is where the research part of what we're doing is so important, because the research becomes the evidence base behind the work that we're doing, and we know that within that research we get significant results with people we work with.
Absolutely.
We also know we get the most significant results with people that do our nutrition and psychology approach combined, and that's consistent in what we see with that.
Absolutely.
So in terms of next steps, if someone's watching this and they'd like to find out more, because I always think it's one thing to have general information, it's another thing to go, so what does this mean to me? How does it apply to my situation? I guess the next step is for someone, if they've already got an information pack, to have a free 15-minute chat, and it's maybe just worth briefly explaining what happens in a 15-minute chat.
Yeah, the 15-minute chat is really, by that point, the patient you will have spoken to someone in the team already, so we'll know a little bit of background about you, a little bit of background about the case. So then in the 15-minute chat we can really drill down in terms of what your case involves and what that might mean in terms of treatment, length of time involved, the sorts of things we might look at. 15 minutes isn't very long in terms of, we can't take a case history in that time, but what we can do is really focus very much on the case and what that's likely to mean. And to be honest, having done this a lot, it is quite clear from, you can get a lot of information or enough to give a very clear idea to the patient what they might expect.
Yeah, and that's also why when someone has a 15-minute chat, they speak to our new patient coordinator first, because they will get as much information as they usefully can to give to the practitioner to be able to work from within the chat. So we try and be as efficient as we can within that.
Yes, indeed.
So if you're watching this and you're at least curious to find out more about our approach, whether it may be of benefit to you, the best thing really is to arrange a free 15-minute chat. There's various places around the website that you can do that. And also continue to watch other videos, read about our approach. The more you know about what we do, the more in a chat, effectively, we can focus on helping you rather than just giving you background information on our approach and that kind of thing. So thank you, Tanya. Thank you for watching. And we really do hope to have the chance to talk with you in a 15-minute chat at some point very soon.